Have you ever lost weight, were proud of yourself only to regain most or more of the weight? Hi, I'm Dr. Christine Ince, and I want to introduce you to our next guest on Barunsu Balance podcast, Dr. Alicia Shelly. She's a board-certified internal medicine, obesity medicine's practicing physician outside of Atlanta, Georgia. Dr. Shelly shares her personal story about her struggle with weight loss and rebound weight gain and offers invaluable insights for getting back on track and staying on track. She is the host of the Back on Track Achieving Healthy Weight Loss podcast and Thrive for Today YouTube channel. Dr. Alicia Shelly is a renowned speaker and has spoken at a recent National Medical Association convention and best-selling co-author of Made for More, a book for physician entrepreneurs. She has been featured on CNN, Upscale Magazine, and Shape.com. Dr. Shelly is also a marathon runner in her spare time. How does she balance all of this? Stay tuned.
Barunsu Balance Podcast. Balance of the mind, body, and soul helps us navigate the storms of life. Balance emphasizes the close relationship between mental and physical health. Balance says that a spiritual life and hope for tomorrow is essential. Dr. Christine Ince is a semi-retired medical oncologist and health enthusiast nerd. This podcast is a lively, informative conversation between an older generation who have often said, "If I knew then what I know now," and a techno-smart, "I don't want to be stressed out," younger generation. The host and guests exchange wisdom on how to live a balanced, healthy, and fulfilled life, despite today's exhausting ups and downs. Barunsu is Japanese for balance and is in honor of Dr. Ince's mother, who is 98 and of Japanese heritage.
Welcome, Dr. Alicia Shelly, to the Barunsu Balance podcast. This program emphasizes the importance of the balance between the mind, body, and soul. And today we are going to talk about, we want to encourage our listeners in their goal to achieve a healthy weight journey. So, Dr. Shelly, I'm so impressed. Doctor, author, podcaster, marathoner, I believe Ironman competitor, and host of Back on Track. So I want to start off with a question as to what is a healthy weight? So often when I would speak at churches or would speak to my patients and from a certain cultural background, they say, "I'm not overweight. I look good. I feel good. I may be a little thick, but I'm not overweight." So can we start off with that question, Dr. Shelly?
Yeah. So what is a healthy weight? And it honestly really depends. It's individualized because not everyone else is going to have a healthy weight for you may not be a healthy weight for me. And I will explain that a little bit later as I continue. So what we have, or what the medical society has come up with to kind of see how to categorize people, whether they're in a healthy weight or a not so healthy weight, is what we call the body mass index. And so with the body mass index, it looks at your height and it looks at your weight, and it puts you in either a healthy category, an overweight category, which is between a BMI of 25 and 29. And then I forgot to mention normal BMI is between 18 and 24. You're considered underweight if you're less than 18. And then you have your obesity range, which is a BMI of 30 and above. And so it looks at your weight and height. It doesn't take into consideration ethnicity, doesn't take into consideration like
if you're male or female.
Male or female, bone structure, because some people are have like a heavy well, not a heavy bone, but just seem to have like larger bones than other people. As far as people who are more petite, they don't take that into consideration per se. And so even though we have this construct, it doesn't necessarily tell us if I'm in the healthy range, am I healthy? And for example, there are people who can be thin but not healthy. And let me just go back and talk about what makes a difference as far as with obesity. So when we look at obesity, it is a chronic disease, and how it's chronic is because it is the dysfunction of adipose tissue or fatty tissue. And so sometimes this tissue can actually be deposited around organs like your liver, where you have fatty liver disease, around your heart, that can lead to cardiovascular disease like a heart attack. It could be around every different organs, or even in your midsection. And that type of fat distribution or visceral fat can lead to poor health outcomes. And you can be a thin person and have more of these visceral fat, and you can also be a not so thin person and still have more subcutaneous fat, which is basically the fat that's under the skin. Okay. So I'm sorry. So to answer your question, I know I'm going around in a circle, but to come back to the question is, what's a healthy weight? It depends on that person, because number one, the question is, where is that fat deposit, whether it's around the organs or under the skin layer? And then number two, how are you as far as with your medical conditions? You can be a thin person and have really bad cholesterol, really bad high blood pressure, and that's putting you at increased risk for medical outcome.
Or not be active physically.
Not be active physically, exactly. Okay. So it's unfortunately, there's no right or wrong as far as healthy weight, but it's more individualized to the person.
Okay. So as a medical physician, what do you warn your patients about some of the consequences, health consequences, and even psychological consequences of being obese or overweight?
So the one thing we always worry about, or at least our goal as a primary care physician and obesity medicine physician, is how can we help people live a healthier life, to live longer and in good quality of life. And so one of the things that I'm always worried about, especially in somebody who has obesity, is what is their risk for developing high blood pressure? What is their risk of developing diabetes? And these different many complications. There's over 200 medical complications that have been associated with obesity. I mentioned before, like the fatty liver disease. Fatty liver disease can actually lead to liver cirrhosis or liver failure. You can have certain cancers that are increased due to high obesity. You can have sleep apnea, where you're at night, you're going to sleep, but you're actually, your oxygen is dropping, and it's causing you not to get a good night's rest, but then it also is putting you at risk for other medical conditions too. So there's many medical conditions that can be associated with obesity. And so when I have my initial visit with the person, I'm looking at their medical history, I'm looking at their weight, but I'm looking at what is their risk of developing other medical conditions.
So I'm a medical oncologist, and especially if I have patients who already have cancer, most of the time when people think of cancer, they think of weight loss. But my breast cancer patients, when they're undergoing chemotherapy, they're actually at risk for gaining weight. And so I'm advising them to maintain their weight, because there definitely have been shown studies that exercising and getting to your ideal weight is helpful as far as decreasing your risk of cancer. So tell me a little bit about your story. We met a number of years ago, and but just tell me a little bit about your story.
Yes. So my story started, I've always been, I had difficulties with my weight even as a child. I would gain weight, and it was just kind of something that just happened over time. I went to different weight loss programs in my childhood to try to lose the weight, but then it would kind of come back. And so it wasn't until college, where of course you gain the freshman 15, I was like the freshman 25, and I was like, oh gosh, we have to do something. And it wasn't until I had my own apartment, I can cook for myself, I was active, that I started to see that weight kind of come down and I started to feel better. But then, of course, medical school came, and that's where the stress came again and the weight came back up. But it came to a point when, after I had graduated from medical school and residency, that I was now an attending. And you would think, okay, now you're out of all the schooling, now you can relax. But that wasn't the case for me. I think I was probably under more stress and more pressure just to try to, make sure I don't mess anything up, that I'm, becoming the doctor I want to be. And I gained weight, and I was at my highest weight a year after my intending, and decided to undergo bariatric surgery. And so with that, I was able to lose around 80 pounds. And it helped me to kind of feel better. I started exercising. I started running. I actually developed a love for running. And, stress happened again, burnt out. And I started to gain the weight back again. And it really came to a head where I looked at the scale and I had gained 40 pounds that out of the 80 that I lost, so 50%. And I'm like, this has to be a lifestyle change. Like, I can't keep going back and forth like this. And so I can't and I committed myself to not taking my eye off of my health, and not just my weight, but my health. So making sure that I'm incorporating the fundamentals into my lifestyle and that it is who I am. And do I say I ever, cheat and maybe eat a piece of cake? Sure, yes. But it's not something I do on a daily basis. And it's not something I do like every week, maybe once a month or even once every 2 or 3 months. But I focus on, number one, giving myself grace, but focusing on these lifestyle changes that help me to be able to not only I lost past that 40 pounds, but then be able to maintain it.
That sounds wonderful. So I understand that you are an author of a book that encourages physicians. Is that correct? And as a physician, can you just tell me a little bit about that book?
Yes. So the title is Made for More: Physician Entrepreneurs Who Are Living Their Life on Their Own Terms. And this book actually helps with encouraging people. It shares stories from 40 of my friends and classmates who have actually embarked on a business venture outside of medicine, whether it's their own practice, whether it's a coaching program, whether it's a podcast. It kind of shares the different just different areas that people struggle and how they overcome. Each chapter is different. Each chapter, all the chapters have actually really good gems and things that can help, especially if you're trying to go into business or even try something different. I still work full time, but my podcast is like my baby or my passion, that I'm able to share my thoughts with the world. And so it just kind of gives me another opportunity. And so with that particular book, it just kind of encourages physicians as they go along their entrepreneurial journey.
I think that's wonderful. When we were in training, we were so focused that there wasn't a lot of room for balance in our lives. And what you're doing is encouraging other physicians and other people in high stress fields to be comfortable with branching out with their passions. I play the flute and have, in bands for years, and that's one of my passions. So tell me about the Back on Track program with your with the podcast, with your patients, and how did you come up with that idea? And tell me a little bit about the guiding principles that you have for your patients and clients.
Yeah, so definitely. So I actually have I am part of the obesity medicine department at my institution, which is WellStar Hospital Systems in Atlanta, Georgia, and we are part of the Centers of Best Health. And in that particular clinic, what we do is we are able to kind of see people and help them with a multidisciplinary approach, where it's not about being on a fad diet or taking medications for short term, but it's more of a long-term approach where we're focusing on the healthier habits, the eating right, the exercising, because we know that all of these are important for healthier life. Now, everyone has different obstacles and challenges that they have to face. Not everybody's able to move the same way. They may have to do things more individualized based on if they have back pain, knee pain, and things of that nature. But we offer a dietitian, exercise physiologist, a psychologist, a support group, so that we can be able to help our patients be able to not only lose weight, but then also maintain it and change their health trajectory. And that same premise is what I use for my podcast. On the Back on Track, Achieving Healthy Weight Loss podcast, we focus on strategies on how people can be able to overcome the challenges that stop us from wanting to be healthy, the time obligations, the family obligations, work obligations that just kind of stop us from wanting to focus on it. Sometimes we're so busy that it makes it more difficult. And so these strategies help people with being able to overcome those obstacles. We were talking about different obesity topics like bariatric surgery, medications, healthy living, mindfulness, things that will help people with having a more 360 approach to their weight loss. Because it's not just about losing weight, but it's about being healthy. And like I mentioned before at the beginning, what I mentioned before at the beginning, that our goal is to be healthy and prevention, so we can prevent the stroke, prevent the heart attack. So that's kind of my thought with the podcast and the clinic.
Okay, so I watched one of your first podcasts, and you mentioned the term SMART goals. Can you describe what is a SMART goal and how do you go about achieving these goals? And it sounds like this is applicable to other areas of our life when we have goals that seem kind of unattainable.
Yeah, and you bring out a good point. You can use this with any aspect of your life. But the one thing I see with having extra weight and trying to get it off, sometimes, especially if you had gained some of that weight back that you had lost, it can be very discouraging and very distressing. And so sometimes it's hard to kind of restart the different healthy habits that kind of made you successful earlier. And so with the SMART goals, it kind of helps break it down, the different healthy habits that you need to do. A good example of this is that it's not a SMART goal if you're like, oh, I just want to lose weight. The question is, can we get specific? So when we look at the acronym SMART, S stands for specific, M stands for measurable, A stands for achievable, and then R stands for reachable, and T is timely. So you're kind of looking.
I'm smiling because I'm taking notes like the way you are.
I'm sorry. Just slow down. I'm sorry.
Okay.
And the reason being is that these are specific. So yes, I want to lose weight, but specifically, what do I want to do to attain this? And so you may say, hey, I want to lose weight by actually eating more fruits and vegetables in my diet on a regular basis. So you say, hey, I want to eat 3 to 5 servings of fruits and vegetables each day. Is that something that you can measure? Yes, because I can see how many did I do 3, did I do 2 vegetables? Is it something that's attainable? Like, is it realistic? And the answer is yes. Or is it achievable? The answer is yes. And R, I said, I forgot what I said, but it should be realistic. And 3 to 5 servings is more realistic. Now, if you're like, I hate vegetables, then it may not be realistic to have that goal. So it's better to kind of pick something that you can actually do. So it's a small goal that you can do, and then timely. If you're like, well, I'm going to do this per day, then you can kind of measure the time. The reason why SMART goals are important is because a lot of times we put out a lot of goals on what we want to do, like New Year's Eve resolutions or New Year's resolutions, and we don't do it because there's no plan on how we implement it into our current lifestyle. So we do something for a couple days, maybe a couple weeks, but then we fall off. So the whole point of the SMART goals is to make it so that you can intertwine it in your lifestyle and that you can be able to be consistent and maintain that down the road.
So how do you go about setting the goal of, let's say you want to exercise and you work 10-hour days? How do you get that into your 10-hour day? Do you incorporate during the 10 hours? You like walk up and down the stairs, or I don't know, do jumping jacks in the hallway or between patients?
All of the above, right? Because a lot of times in those 10-hour days, you may come home and you're like, I am so tired. All I can do is just fall into the bed, eat and fall in the bed, and that's it. And so with that particular SMART goal, you may have to be less, you definitely have to be specific. So instead of saying, hey, I want to do 30 minutes a day of exercise, and maybe like, listen, I work, let's say you're a nurse and you work 4 10-hour days. That's total of 40 hours for the week, but they're 10-hour days. You may say, hey, the 3 days that I'm off, I'm going to commit to at least an hour of physical activity because I know at least I have more time and I won't be tired. Or you may say, hey, before I go to work, I'll do a 15-minute physical activity where I may get on YouTube, look at a workout, or I may go walking around my house, or go walk outside for 15 minutes, walk my dog for 15 minutes, and then come back. And then on the weekends, I'll do something a little bit more extensive in order to kind of meet that goal. And so I'll also say you want to make sure whatever goal you choose when it comes to exercise is that it's something you can implement. That is not something that's going to overwhelm you or make it to the point where you're like, well, I just can't do this, so I'm not doing anything. So that's kind of how I would approach it as far as with the SMART goals, the exercise. I pick something that is, I can be specific, but something that's attainable and realistic for me to be able to do.
So again, as physicians, we're high achievers, and our tolerance for error is pretty close to zero. So how do we translate that into ourselves, our goals? We need an A+, not an A-.
I had that where I argued with the teacher why my A- was not good enough. So I definitely understand. And the one thing I have to tell people, like, this is a marathon, not a sprint. And so we really have to actually focus on giving ourselves grace. Like, we really have to practice because it's very hard because we want to do everything right. And if we don't do it right, then it's not going to work out. But in actuality, you doing something, like, let's say in those 10-hour days, you couldn't do the 30 minutes before you went to work, but you did 15. 15 is better than 0. And so at least you were able to do that. So giving yourself grace is important, especially when you are type A and you want everything to be right now.
And walk up the stairs instead of
And
taking the elevators.
Exactly. And you can implement it throughout the day.
Right. After discussing with your physician, go ahead and walk up 6 or 7 flights of stairs.
Yes.
Hospitals have a lot of floors.
They do. And I remember residency, we did not take the elevator. We had to walk up the stairs for each floor.
Okay. All right. So one of my look back regrets is that I didn't do a lot of cooking when the kids were young. So you're going to say, well, how would I have gotten that into my schedule? Again, 10-hour days. And on top of that, decided to get a master's in healthcare administration. For what reason? I do not know. So
seemed good at the
time. So I feel that a balanced diet is way up there in the healthy life weight journey. And so how do you get that into your busy day?
So I have to, you have to delegate. And I'm going to be honest with you, I can't say I am the best cook. I think if I had more time, I could, practice this. And so what I kind of like to do is I will get a meal service. There are different meal services around who will deliver the meals every, healthy meals every week. Here in Atlanta, we have a store where it's like they have fit foods. So you can go there and get your foods for the week. And they're healthy foods. So you have your protein, your greens. So it's actually well balanced. And I can just have that and eat on that because I'm on the go a lot. The other thing that, let's say if I don't do a meal service, I will actually try to meal prep on Sunday where I have more time. And it gives me more time to actually write stuff out, what I need from the...
I'm sorry, Dr. Shelly. So what exactly does meal prep mean?
Oh, yeah. So meal prep means you kind of like write out your list for like what you're going to eat at the grocery store. And let me just put this pause. Sometimes if you don't write it out and you just go and start perusing, you will pick up stuff you do not need. You'll be like, this pasta looks great. Oh, let me go down this candy aisle. Like, so I recommend to write your, like, and what I'll do is I'll have like a little calendar for the week, and I'll write out what I'm going to eat for the week.
Or those potato chips are on sale. Now, why in the world do they suddenly go on sale now when I don't need them?
And they're right here at eye level. There's a strategy for these things. That's why you have
when you first go into the store, you have to pass them.
Exactly. They have all the chips, all the sodas right here. So the one thing I would say too is that when you are in most grocery stores, if you go around the edges, that's where the healthy food is.
I heard of that.
Is not, and I've been to like multiple different grocery stores. I'm like, they're absolutely right. I don't need to go down this aisle. Stay away. So what I like to do is on a good day, I'll write it out what I'm going to eat. And now I'm somebody that I can eat the same thing every day. It's fine as long as it's good and fresh. And so I'll write out what I'm going to eat for lunch and for dinner and for breakfast. And then I'll go into the grocery store and pick it up. The other thing is now that they have like where they can shop for you. If you have problems, if you get really tempted going into the restaurant, you don't have to. They can just put the groceries in your car. So that's one good thing that came from the pandemic. Okay. And then after that, I allow like for that time in about 3 hours. Like I'll go grocery store and then I'll come back and I'll cook and I'll prepare. I'll set up, I have like different meal prep containers. You can get them like at Walmart, $10. You get like 10 of them. And so I'll have enough for the week and then I'll just kind of put it there. It helps me because in the morning when I wake up and I'm rushing, trying to get to work, all I have to do is, okay, here's my salad. Here are the fixings, put it in the bag, let's go. And if I'm really good, I can prepare the night before, and then all I have to do is pick up the bag. But let's just at least I prepped. That never happens. But it at least allows me not to have to think about it. That's the thing. Okay. When you're busy and you're working 10 hours a day, the last thing you want to do is have to decide, what do I want to eat? If that's the case, then you're going to probably choose something that's not as healthy because number one, you're hungry. Number two, you want it fast and quick. So by meal prepping, it really helps to be able to eat a more healthier diet and less stress and less thinking.
Okay. Well, thank you so much, Dr. Alicia Shelly. And we want to make sure that we all get back on track with our healthy lifestyle goals. And it's just been wonderful meeting you again after a little break.
Thank you so much.
Did you have any last words to our listeners or questions for me?
Yes. To our listeners who may be trying to or struggling with their weight or just with their healthy lifestyle, know that it doesn't have to be too complex. I see a lot of patients and they tell me, well, I know what I want to do. I know what I need to do, but I just don't do it. And so my suggestion or my strategy is pick one thing, one small healthy goal that you want to do, whether it's I want to exercise 3 days a week, or I want to, eat more fruits and vegetables, whatever that is, and just start. Don't wait till the beginning of the week to do it. Just start now. Because if you wait, it's not going to happen because something else will get into the way. Some other priority will pop up. So it's better to start and to start now.
Okay. Well, thank you so much. Until next time. Bye.
Bye.
Thank you, Dr. Alicia Shelly. We want to prevent long-term chronic illnesses. You have challenged us to start with small, smart goals as used in the business world. Specific, measurable, achievable, relevant, timely. You told us at the same time to give ourselves grace. God gives us grace every single day. Dr. Shelly can be reached at drshelleymd.com to help with your weight loss goals. Remember, it is important to seek the advice of your personal physician or healthcare provider before undertaking a new healthcare regimen. This is Dr. Christine Ince wishing you a balanced, healthy, spirit-filled life. If you enjoyed this program, please give us the thumbs up, 5 stars, share, and subscribe.